Hello there, and welcome. My name is Calliope, and I am going to be administering your medical massage treatment today. So, just remind me, what is it that we are treating today? I see. Okay. Let me just double check my notes here. I see. Alright. So we've been having some trouble with the back as well as the tendons at the elbows, maybe even a little bit with the wrists. Okay, I see, very good. Now, is that the upper back, the mid back, the lower back? Tell me a little bit about what it is that you're looking to have treated. And for the elbows, are you having issues more with the inner tendon here or with the outer? A little of both. Okay. And what about the wrists? What kind of pain are we having in here? Okay, so maybe a bit more from overuse as opposed to carpal tunnel or something of that nature. Very good. All right. Well, I can certainly address all of those today. And we are going to be starting with the back, and then we'll work on the elbows and the wrists. So I would like to get you all situated, and we can talk a little bit about what it is I'm doing and how it differs from, say, a relaxation massage. Now, for this treatment, I am going to need to be touching you. Is that okay with you? Do I have your consent to do that? Excellent. Thank you. So I am going to have you just lay on your stomach on the table here, and I am going to provide some draping, and then we're going to work on the back. Are you comfortable? And how is the temperature of the room? Okay, that's comfortable. Do let me know if at any point it is too hot or too cold. If it is too cold, you will unintentionally tense up the muscles. And if it's too hot, then the skin is going to get a little sweaty and can have a bit of a slip and slide. So just want to feel around the back, and I'd like to see where our most tender spots are. So as I just press in, let me know if it's painful. Okay. Okay. we're going to start a little bit systematically. When I work on an area, I'm going to be warming it up first so that we can do some work in the tissues, and they allow us to get in a little deeper. So let's start. So this massage, as we go on, it might be more uncomfortable as opposed to relaxation massage that you might be more used to. So if it becomes too much at any point, do let me know. Medical massage is used as a therapeutic complement to other treatments. So you might be prescribed certain stretches or heat or cold therapy. You might be prescribed anti-inflammatories, but the massage helps with a variety of musculoskeletal conditions and injuries. So we can use this to treat, for example, headaches or temporomandibular joint pain in the jaw. We can use it for sports injuries, overuse injuries, strain, arthritis, frozen shoulder, things of that nature. And we tend to use techniques more like trigger point therapy, neuromuscular therapy, myofascial release. Might use passive stretching. Do a lot of that with the wrist. But the aim is to remedy an area as opposed to soothe it. We can use a variety of kneading and sometimes friction techniques. And for your sort of symptoms, we're trying to release some of the muscle tension so that it's not so locked up. And we can give the muscles a little bit of space so that they can heal. We can promote circulation, get some fresh blood flow to the area. So I often work in combination with physiotherapists, sometimes osteopaths or chiropractors. I'm just going to feel around here. Let me know if there's a spot that's very tender. Right in here. Okay. And with a firm pressure, I'm going to be pressing in. And let me know when that starts to release for you. I can feel a little bit of it very slowly unravel. But when it doesn't hurt as much for you, I sink into it just a little bit longer, and then we can release that area. Sometimes the muscle fibers get a little stuck, and sometimes what we're trying to do is just unbind the fascia, work a lot with fascia. Right in here. Sink into that. Good. Good. Some spots will unwind quicker than others. Some of them we really have to sink into for a while. Okay. Sit in here just a little bit longer. Good. Yeah, that's how it's going to be going, is that we'll have those uncomfortable bits, but it shouldn't be too much to handle. But we're doing a lot of work. We're not just trying to soothe the problem, but we want to get rid of it. It's working here. So, what is it that you think has been going on that's made your back so locked up? Posture, yeah. Yes, that tends to be the biggest one. It's kind of strange, we're given these bodies, but not any sort of manual on how to take care of it. So, of course, there's going to be things that happen that we don't know what to do. And the body is extraordinary at compensating and building up in another place to address a weakness or soreness in another area. But even the body doesn't really know what it's doing is actually making things worse. But it's just kind of like, well, I need this area to work. This is the tool I have to make it work. This is what we're going to do. Let me know if there's right in there. Okay. But that's where we come in, and we help with a variety of different treatments to address the imbalance and tell you how it's supposed to feel and how we're supposed to use our body in a way that makes it so this doesn't happen again, or it happens much less frequently. That's good. Okay. There we go. Okay, let's get in here. You'll likely feel a bit of soreness in the back when we're finished. And I would recommend drinking a lot of water when we're done with this session. Water is going to be your number one tool besides rest. We want to make sure the body is hydrated, that our lymph system is working properly, our kidneys are flushing out toxins, and that's one of our biggest helpers there. How are we doing here? is this pressure? Okay. Good to know. Let me know if there's a spot that feels tender. Right in here. Okay. Is that right there? Good. Let me know when that dissipates. Right in here. A little too much. Okay. I wasn't certain. Sometimes this area can take a little bit more pressure. Okay. Just a little bit longer. Sore spot. So this is going to be the first of many sessions, I imagine, I'll have with you. Another difference between relaxation therapy and the manual therapy of medical massage is that it is a program as opposed to just a one-off. So enable to enact real, tangible, lasting structural change. We're going to have to be doing this for a little while. It takes the body a minute to release old patterns, even if the ones they were holding were not beneficial. Right in here. just have to work bit by bit to unlock the fibers and promote a healthy pattern of holding. It's better? Okay, just settle in a little bit more. Very good. So it's mostly this area right here we were having our most issues with. I am going to have you get back up to sitting in the chair, and we're going to work with the elbows, the tendons of the elbows, as well as the wrists, you said? Very good. So let's go ahead and get you all settled, and we will work on those. As for the elbows and wrists, I'd like to just feel around a little, if you don't mind. I'm going to see if there are certain tender spots and how I want to go addressing this. So as I am just pushing in here, right on the outside of the elbow, what does that feel like to you? Is that tender? Okay. And if I start pressing in on the inside, okay. And the other side, I can just have this arm. Good. And if I just press in along the outside here. Okay. And what about the inside? I see. So I assume you were recommended some stretches, some icing, and of course rest, correct? Yes, for the arms and for the wrists, absolutely. So we've already got some of those core treatment necessities. So what I'm going to do is I'm going to come in and loosen up these fibers and give them a little bit more room. So this is going to be a little uncomfortable. Let me know if it's too much, okay? This is going to be a very sore area, but that soreness tends to dissipate pretty quickly when we break up these stuck areas. So we have the tendinitis here, can be colloquially called golfer's elbow or tennis elbow, depending on which side you have it on. And some unlucky people have it on both sides. We see this a lot in overwork injuries, or even just with people holding their phones and they hold them quite close to the face. And so the arms stay bunched up like this, as opposed to being more out. So that can be helped with some of those bands that help put pressure on one side of the tendon or another. But it's best instead to have our prevention practices rather than trying to treat it after the fact. Good. Okay, so I can feel some of this loosen up. It's going to take a little bit before it actually feels nice, as opposed to having a lot of pressure here. But as we warm this area up, the muscles tend to loosen and almost melt a little. They can get so rigid. Okay. And I'm going to be pressing in here. We're going to try to alleviate some of these trigger points. And just let me know when the pain is not so sharp. Okay, right there. You can feel it very slowly start to unwind. Okay, right in here. Good. That's done. Good. Coming in here. Yeah, this one can almost feel more tender right on the inside of the elbow. Good. Good. Now let's just feel around. Let me know if there are any really tender spots. Okay, not so much. All right. We will work into just opening this up a little bit more, and then I'll work on the other side. So something I found quite helpful to address the elbow, wrist, thumb sort of injuries, they can often go together, is that when we do our cold therapy, our ice therapy, what we are doing is putting our pack or our ice for 20 minutes and no more. And instead of just treating one area at a time, I like to strategically place the pack. That way we can get the elbows, and then I have the wrist, and then I put it around my hand. And by the time you're done with the hand, if you have time, you can go back to the elbow. Good. Okay, let's get in to the other side. Alright, so already we have those tender spots. Okay, Okay, and as I'm pressing here, is that making it worse? It is, okay. And what about the inside here? Alright. So let's work by just opening that up. We'll start out gentle. You go in too firm, too quick. Sometimes those muscles lock up even more. They don't often like to be forced into anything. You kind of have to persuade them. So that cold pack therapy, that I found works really well if you are already kind of chilling out. Like if you're watching TV, sometimes if you are playing video games even, just depending on how you arrange yourself, you can also sometimes be able to get a little bit out of that too. Just kind of depends on what exactly you're playing. I mean, if you're playing COD Blobs 2, maybe not so much. But if you're playing Skyrim or something, maybe you're a little more stationary, a little more relaxed. And also changing how you play video games, if you do happen to game, can help as well. I'm a PC gamer at heart. That's just what I'm most comfortable with, and all my favorite games are PC games. But PC gaming is not good on your anatomy, not at all. But if you connect a controller, like I have an Xbox controller, you can play some games like that. So things like Grand Theft Auto San Andreas or Minecraft and Terraria kinda. A lot of that you can work with it while you're recovering. It's better than not being able to play at all. Now, let's check on those trigger points. Okay, so I'm going to press in right here. And I just want you to let me know if the pain goes away. Okay, there. Good. Hold it for just a bit longer to make sure that everything unwinds. Good. And right here. I know it's not fun. It's not fun. The thing with therapeutic massage is we're doing work, and sometimes it really feels like work, rather than relaxation massage, which tends to soothe. Okay, and on the inside here, just let me know when that unravels for you. Good. And what about right here? Okay, we'll sit here and let it unfurl a little bit. Good. And let's open that up just a little bit more. Here we go. So I assume that you've already talked posture practices with your physiotherapist? Okay, good. It's part of that prevention. Okay, we're just going to loosen this up just a little bit more. And these may feel pretty sore after I'm done. A lot of this muscle manipulation can leave them feeling a little fatigued. As I said before, we're doing work. It's going to kind of feel like work. Okay. Now let's take a look at the wrists. Just going to do a little bit of movement here. A little bit of passive stretching just to see where we're at. How is all of this? Okay, a little sore. The other side. How is all that? Okay. So this is a bit of an interesting area in that we can do some trigger point work, do a little bit of stretching. Massage itself seems to be a little less effective. It's almost, I hate to be crude about it, but there's not a lot of meat to work with. But a lot of these trigger points and working through the impinged mobility, we can certainly do that. So I'm just going to warm this up a little. Okay, let's see if we can get a bit of movement in here. So, you could just let me take the weight of your arm, and we're just going to come back a little. And this can help warm up the muscles a little bit as well. Good. Good. And then let's check in on some of these points. So let me know if a particular spot is painful. Okay, right in here. Right, let's just sink into this a bit. Okay, and it's unraveled a bit. Good. Okay. And just a little bit more. Right in here. Okay. How about that? Okay. Poke around a little bit more. Pretty good. Okay. Let's finish off with just opening up the muscles a little bit. Then we'll move to the other side. Okay. And if I could have the other wrist up a little. Okay, and let me take the weight of it. Just let your wrist go floppy. Okay. We'll do a little bit of passive stretching. A little bit of mobility in there. Open up all those tiny spaces between the muscles. Okay. Let me poke around a little. Let me know if a spot is tender. Right there. Okay. Let's dip into this. Do you have anything exciting happening after this? No. That's just fine. Rest is very important to your recovery. So, even if it's just rest, and I don't want to sound belittling in that because rest is extremely important. We work much more effectively if we actually give ourselves time to have a little break, a little reset. So, resting is absolutely good. I would highly recommend it. Okay, tell me if there's another spot. Okay, we'll sink into this one. Okay, it's about gone there. Right. Or just a little longer. Let's poke around just a little bit more. No? Okay. Let's go ahead and get in around the sides. Be very, very careful on the inside of the wrist. Just mostly moving the skin there. But right on the outsides of the joints here, even the back. Just warm that up. Give it some room. Okay. How did all of that feel? Feels a little strange, doesn't it? Yeah, a massage for therapy as opposed to relaxation is definitely an entirely different experience. Well, we have addressed your back, your elbows, and your wrists. Is there anything else I can do for you? Okay, wonderful. So, I'd like to see you back next week whenever it works for you, and we can work in again and see if we can get all those little fibers to just pull open a little bit more. All right? Wonderful. Thank you so much for coming in today, and I wish you a speedy and thorough recovery. I hope you have a whale of a day and a good rest of